This is going to be intense. So if you're squeamish about this sort of thing, probably skip ahead. Hey, my name is Dr. Robert Duff. I am a licensed neuropsychologist, and today I am really excited because we are going to be reacting to the final episode of season 2 of The Pitt. I'm a big fan of The Pitt, and I've been wanting to do reactions to these. Typically, my wife and I watch it as soon as it comes out together. She's actually watching it in the other room right now because she didn't want to do a reaction. But there's so much that I've been wanting to react to in this season. First off, there's a lot of really good psychological and neuropsychological stuff from, there's going to be spoilers here, but from the elder care episode talking about, moving into an assisted living facility, to the bombshell dropped at the end of the last episode with Dr. Al-Hashimi's diagnosis with the epilepsy caused by, I think it was spinal meningitis, viral meningitis, whatever the case might have been. So a lot of really interesting stuff. And I also really enjoy how the first season was kind of like the enemy from without, the whole mass casualty event and everybody rallying together. And this season has been a lot more about the enemy from within. So people's own demons, the, crew falling apart, Dr. Robbie obviously on his crash out. So it's going to be super interesting, and I can't wait to talk about some of the stuff that we see. So let's go ahead and dive into it.
It began after a bad case of viral meningitis when I was 5. They tried every anti-seizure medication, but I still had episodes every few months or so. No one...
Before she finishes what she's saying, so seizures can look different from person to person. A lot of times we're used to seeing grand mal seizures where you have full convulsions, people with really, really extreme symptoms. Another type of seizure is often called what's referred to as an absent seizure, and that's when somebody kind of just blanks out and they lose consciousness. Essentially, they're not aware of what's happening to them, and it could be for a few moments, could be a minute. It's very similar to what you might see also in people with Parkinson's when they have sort of freezing behaviors. But yeah, a very concerning thing when you're in a high pressure situation, such as being a doctor, being a surgeon, being a pilot, etc.
No one's ever noticed before. They just think I'm thoughtful.
Are you driving?
I couldn't until laser ablation to my left temporal lobe 12 years ago. Between that and the Keppra, I've been seizure-free.
Laser ablation, meaning going in and actually burning part of the brain. Earlier on, and even now, in epilepsy, if there's a focal part of the brain that's causing the seizure or that the seizure is originating from, you can get neurosurgery to remove that part of the brain or to damage it. In the case of a laser, there's different options there, but you actually go in and do neurosurgery to stop them from continuously happening. And then the Keppra, that is an anticonvulsant, so a seizure medication that's supposed to keep the seizures down.
Cleared by neurology to drive and to work as an attending.
How long between the seizure you had today and the last one?
It's been well over a year. But I had 2 today. I don't know why. It could be sleep deprivation, new job stress. I haven't had to deal with PEDS cases since Afghanistan.
What are your options now?
Up my Keppra, or maybe try one of the newer anti-seizure meds. But if that doesn't work, I'm left with 2 choices. A temporal lobectomy, which could impair my speech, or...
So lobectomy meaning taking out the whole or part of the temporal lobe. Temporal lobes are on the side of your head, and that has a lot to do with language ability, as you mentioned. Left in particular has a lot to do with language production. Also memory, depending on how deep you go.
Or get a neuromodulation device, which can sense and stop the seizures almost immediately.
You need to disclose this.
I know. I have a plan.
Hey, Robbie, Dana's looking for you. She's in PEDS.
Yeah, okay. I'll be right there.
Sounds like you're needed in PEDS, and I have patients to see.
Robbie, a pregnant woman with severe headache on her way in by ambulance.
Find Abbott or a night shift resident.
It's a really tough position. Obviously, Robbie's having his own mental health stuff right now, but there are certain neurological issues and other types of, disabilities that can get in the way of performing specific job duties. obviously seizures could be one of them. As she mentioned, she has a plan. She has multiple ways of addressing it. And for Robbie, it's important to strike a balance between, caring about the care that's provided by the individuals in this hospital and also being a medical care provider and a colleague at the same time, and not overreacting to that, because there are many people with various forms of epilepsy and other neurological conditions that are able to be in positions like this. So it's important not to jump the gun on that. And it's not like she was hiding something. She said it's been, what was it, a year since her last seizure? So this is new and this is interesting, but it's not necessarily like a death sentence. The only problem is that he's leaving supposedly this night.
Oh, sorry, false alarm. I thought she suspected fever, but it was the wrong chart for my analog hell. You know anybody who might consider kinship adoption? Doctors and nurses qualified.
Don't look at me. Hey, can your staff keep an eye on Dr. Alice and me until she leaves?
Why?
Okay, so this, I don't know if he's about to disclose what she told him. That gets into multiple layers of privacy issues, right? So her describing to him that she has seizure disorder is not covered under HIPAA because he's not her provider. But within the workplace, there may be certain privacy standards there that he would be breaking to tell Dana this information if she hasn't yet disclosed it.
Because I think she's tired and I don't want her to make any mistakes.
Oh, great advice. Maybe we should take it.
Yeah, I'm gonna go get some fresh air.
Grab some for me while you're out there.
Your lungs wouldn't know what to do with it.
Screw you.
Okay, so dodged a bullet on that one.
You're supposed to be leaving.
I am.
This spirit quest of yours has a lot of people up in arms around here.
Everyone's gonna be fine without me, and it's hardly a spirit quest.
Whatever it is, it seems you've given people the impression you might not be coming back.
Well, who knows what the future has in store for any of us.
Yeah, saying shit like that right there isn't helping. People are worried about you.
Dr. Abbott.
I love Dr. Abbott in this show. He's very no nonsense, and he's saying it exactly like it is, right? Things you won't regret saying, things that you might regret not saying.
Patient at South 21 Digby, he's missing again.
Sounds like a day shift problem.
Not if he was handed off already.
Here's the thing, when people worry about you, it makes me think that I should be worried about you, and I don't like worrying about things.
Oh, now you're a shrink.
No, I'm trying to be your friend. You got Dana convinced that you're gonna hurt
Dana's
yourself.
got her own issues.
That sounds like projection.
Are you seriously trying to have this fucking conversation with me right now, man? I'm not the one who spends his free time getting shot at. Ooh-wah!
Hey, Dr. Robbie, this is Judith Lestrade, 36 weeks pregnant with 2 days of headache, now a 10 out of 10 with blurred vision. BP 174/120, heart rate 92, no relief with fentanyl.
This 81-year-old nun presents with the red, itchy eyes with secretions for the past 2 days.
Oh man, they are tired. That's real stuff. I mean, they're well past their shift now, and you see the pace here. Like, there's only so much your brain has to give, and you need sleep to function well. I've definitely tried going without sleep for extended periods to get more done, and your work suffers even if you don't think that it does.
You're any closer to deciding what's next for you?
Yeah, I'm seriously considering law school.
What? What are you talking about? You're gonna be a great doctor.
I mean, no offense, but look what this place does to you. Langdon's an addict.
He's a person with a substance use disorder.
McKay was on house arrest. Dana's a time bomb. Santos is one of the angriest people you were ever going to meet.
Sarcastic, yes. Cynical, definitely. I don't know if she's,
Mel. Samira has no...
Mel, I don't know why she didn't say anything there, but, she's not neurotypical, just like her sister isn't.
No life. Abbott's an adrenaline junkie who gets shot at for fun. Robbie's got, like, PTSD or something way fucking worse.
I mean, I'd hate to know what you think about me.
I don't know. The more time I spend here, the more I realize the importance of, like, mental health.
Oh, okay. CTG is on.
CTG?
Cardiotachography measures the baby's heart rate and checks for contractions.
Feel heart rate 128. Normal range nasally?
110 to 160.
One of the amazing things about this show, I think, is that they don't use any soundtrack. So what you hear is just all the sounds of the environment. If you've had a kid before, if you've been in for monitoring, you've heard the heartbeat through those devices, and between the beeping of the machines in the background, the heartbeat, very visceral.
But the baby's okay.
Right now, yes. 128 is reassuring.
BP's 170/119, 6 grams of magnesium running in.
Your next move, Cruz? 20 labetalol IV push over 2 minutes.
What's happening?
You have a condition called preeclampsia.
And how did that happen?
Nobody really knows, actually. It affects about 10% of the pregnancies. High blood pressure, headaches, protein in the urine, and swollen ankles.
Okay, well, it's a wild pregnancy, so that means no medical care.
Then why are you here?
I just need to get rid of this headache. Hey, Becca, how you feeling?
I'm better, thanks.
Where are you?
I'm at Adam's house. Can I call you later? We're watching a movie.
Oh, sure. I thought you were gonna see the fireworks.
Nope, we decided to watch Elf instead.
Ah, of course you did.
Okay, I'll call you tomorrow.
Tomorrow? Wait, are you spending the night?
Yes, his parents invited me.
They need to ask me that.
Are you staying here too?
No, they needed to ask if it's okay if you stayed.
Why?
Because...
This is an interesting one. They've talked about this earlier in the season, but her sister has supportive decision-making, and Mel is her power of attorney, meaning she can help with certain decisions and make decisions on her behalf, but she's not her conservator, so she doesn't have any ability to make decisions that override hers about, her person and what she does with herself. And in cases where there is no, clearly identified abuse, when, for instance, consenting adults doing things together, like she doesn't actually have any power there. And this is more of a Mel issue than a Becca issue.
It's polite. It's the right thing to do.
How's the headache?
Still a 10.
More fentanyl?
Yep.
BP's good. Another 50.
Hey, Abbott. Attending resident are stuck in the OR.
Oh, you're the next best thing.
Better, some would say. What do you got? This is Judith, G1P0 with no prenatal care, preeclampsia with severe hypertension. Hi, Judith. Nurse Garvin from OB.
Some jelly on the belly. Gonna take a quick look with ultrasound.
No. Ultrasound can harm the baby.
Not true. Not doing the ultrasound could end up harming you and the baby.
Okay, just do it as fast as you can.
Why no prenatal care, Judith?
I wanted a free birth. No doctors, no hospital, no medicine.
You have a midwife?
That's a great question, right? Not, why are you doing this? Like accusatory, not like you should be getting prenatal care. Just why no prenatal care, right? And so let her expand upon that, open-ended.
A birth doula?
No, I don't need one. Women have been having children on their own for thousands of years.
Yeah, with an infant mortality rate of 30% for most of those thousands of years.
Crazy how muggy it still is out here. You seen Robbie?
Not for a bit.
You catch up on your charts from the beginning of the shift?
Yeah.
What are you still doing here?
I was gonna...
What she's doing there is she doesn't have a purpose other than caring for her sister, which is a big risk when you are somebody's, caregiver and you don't have that sort of balance in your life. And now her sister has found some other people to connect with and other meaning, and now she's left without anybody.
Staying for the fireworks?
Yeah. I was supposed to see them with Becca, but she is at her boyfriend Adam's family's house instead.
114, another 40 of labetalol. Mag bolus is in now, infusing 2 grams an hour.
Labs are coming back. Hemoglobin 7.5, platelets 40, LFTs are sky high.
HELP syndrome. Hemolytic anemia, elevated liver enzymes, and low platelets.
They're cleaning a room. We can bring her up in 10 minutes.
How you doing, Judith?
Oh, she's seizing.
Oh, shit.
10 of IV diazepam, have another 10 ready?
With all the movement, we can't get a fetal heartbeat.
Putting on 15 liters by mask. Should we intubate? Hold intubation. Let's try to break this. We don't want to mask seizures with paralysis unless we have to.
So when you intubate somebody, I'm not a doctor, so this is just what I've picked up from working side by side doctors in hospitals sometimes, stuff like that. But when you intubate, you need to paralyze. And so with the seizure, you could be masking an ongoing seizure by paralyzing somebody in terms of their motor functioning. And that could be just hard to, understand and diagnose, or dangerous because you're missing stuff.
Okay. Cruz CTG isn't reading. Check with ultrasound.
On it.
Nasally, what's the diagnosis?
With the seizure, now it's eclampsia.
Fetal heart rate is about 90.
Way too low.
Mom's stats are going down.
Found a tuber?
Set up for it, but wait. Another 10 of diazepam, push 4 grams of Keppra.
So they're using both anticonvulsants, the Keppra, and benzodiazepine to try to reduce the convulsions.
Dr. Abbott? Intubate?
Let's do it. Nasally, what do you suggest for rapid sequence induction?
Etomidate and rock.
Not quite. 120 of propofol, 60 of succinylcholine. Why is that, Cruz?
Propofol for the anti-seizure effect, sucks to avoid prolonged paralysis so we can check a neural exam.
Exactly.
Pushing the propofol.
Once she's flat for intubation, we need to displace the uterus to the left.
Nasally, that's you. Big hug, both arms. Get the baby off the vena cava.
Sucks is on.
This is going to be intense. So if you're squeamish about this sort of thing, probably skip ahead. They're using a different combination of, paralytics and such than they normally would, which is just addressing the point we made earlier about, trying to not mask too much of the emergent seizure symptoms. But holy shit, this is intense.
Forward.
But after she's paralyzed, the seizing stops, right?
It might look like that, but an ongoing seizure will still fry the brain. We monitor EEG.
Is there time for that?
Wait and see. Paralytics kicked in.
Let's go. Roll her to her back.
Intubate, then EEG to see if her brain is still seizing. I need first pass success.
You and me both.
So that's a EEG that's on her head, so electroencephalogram. So that's going to look at her brain waves, monitoring for seizure activity. Important since they've paralyzed her body, since they can't exactly see the evidence of it with her seizing. So they're going to have to look at the electrical activity of her brain.
Good, lung sliding bilaterally.
Fetal heart rate borderline at 98.
Roll to the left again, that can help.
1, 2, 3.
Okay. All set here.
EEG monitor's good to go.
That was fast.
Still seizing while paralyzed. It's non-convulsive status.
That sign says status epilepticus, so she's still having a seizure actively.
What's she had so far?
30 of diazepam, full load of mag, Keppra, and propofol.
Damn, what's your next step?
Any ideas? Nasally?
Dilantin, valproate.
Infusion is too long, so is onset of action. Push 100 of ketamine, that's had results with refractory status.
She also has HELP syndrome. Hemoglobin only 7, platelets down to 30.
2 units whole blood?
O-neg is going up on the rapid infuser as we speak.
Seizing on the EEG. Neurology's been called.
Okay, got it. OB says send her up to have an O already.
About time.
Baby's been breathing down a bit more.
This one looks like it's a concern for the worst.
So they got all hands on deck, right? They have multiple attendings. They have OB there. They're bringing in neurology to help with the possibilities for the seizure. They're using a lot of different medications to try to break this thing.
See a refractory seizures, HELP syndrome with anemia and thrombocytopenia.
Yeah, about as bad as it gets.
VFib.
Fuck.
Chest compressions nasally, charged to 200.
Prep the belly. Get a baby warmer. Call the NICU, start a timer.
Charged. Clear. Continue compressions. We'll check a rhythm in a minute.
Down up. Robbie, it's you and me.
Nasli, what's the 4-minute rule?
I'm not sure.
So they're going to do an emergency C-section while she's seizing and her heart is in a unstable rhythm.
Pregnant patient with a viable fetus. You have 4 minutes after cardiac arrest to save the baby.
And the mom. We don't call it a postmortem C-section anymore. It's a resuscitative hysterotomy to try to save them both.
But she doesn't want any medical intervention.
That doesn't matter. Mom and baby are both dead if we do nothing. Okay, charge to 200, one more rhythm check, and then Abbott and I are gonna cut. Showtime.
We need to get this baby out right now.
Holy hell. Yeah, so they're doing 2 simultaneous procedures right now.
Take a break.
Okay, 10 bleed. Good. First incision is from the xiphoid to the pubic symphysis, through the skin to the linea alba.
Units 3 and 4 on the infuser.
Second incision goes through the peritoneum, exposing the uterus.
Where do you need me?
You're with the baby. Naslie's got the bag mask. You're on suction. Stand by for intubation.
Bladder retractors. Neonatal monitor and pulse ox ready to go.
LS gentle traction. Okay, making a small vertical incision through the lower uterus so as not to cut the baby. Got it?
Yep, I got it.
Okay.
Okay, using scissors to extend superiorly.
Now let's hand retract the uterus with me.
Amniotic fluid looks good.
Wow, the freaking makeup department, special effects department, holy shit.
Some fundal pressure.
Breech position.
Okay. Baby's out. It's a girl.
That's a purple baby, come on.
Milking the cord.
Clamping.
Cutting.
Okay, blue and flaccid. Coming to you, Shen. You ready?
Yeah.
You got it?
Yeah.
Wow.
Poor tone. No movement.
Keep the blue light closer. She's really blue. Some blue is normal, but not this much.
Come on, baby.
Hey, Jordan, charge at 200. Stand by for the next rhythm check.
She grimaced. Good sign.
Bagging.
Pulse ox 45%.
I've never seen it that low.
It's not as bad as it sounds. I'm more worried about the heart rate. Okay, get ready with an IO in case we need epi.
Okay.
IO, intraosseous, so into the bone. You can't give the baby an IV.
Rhythm check, hold compressions.
Still VFib. Okay, shock it. Clear.
Resume compressions.
Whoa, whoa, whoa. Hold up.
Is there a problem here?
Yeah, you two aren't leaving empty-handed.
What?
When are you following me? Rape kits are supposed to be picked up within 72 hours of collecting them. This one's been here for over 2 weeks.
That's not on us.
Well, it's on somebody. It's not bad enough these poor women go through an assault plus the indignity of the whole collection process, but nobody from the police department even has the human decency to come get these things?
Fuck yeah, Dana.
Like, nobody there gives a flying fuck?
Okay, we got it. We'll see that these get put in evidence properly.
We're at 5 minutes.
Heart rate is 132. Pulse ox 79%. Nasli, the APGAR.
One off for color, one off for tone, one off for respiration with hypoxia, total of 7.
Respiration scores for observed breathing, not pulse ox.
Stat of 80 is normal at 5 minutes. With no crying, she still gets 1 off.
Getting closer. Hey,
She just scored the winning point. APGAR of 8 is pretty normal.
goddamn.
Holy shit. What did I miss?
Eclampsia with status, HELP syndrome, cardiac arrest, resuscitative hysterotomy.
That'll do.
There's a lot of trauma being tapped to in these recent episodes. Dr. Alashimi clearly has something, trauma related with babies. She's spent a lot of time with baby Jane Doe and had some moments there where, it seemed like she was maybe experiencing something significant. She also mentioned not working with peds since Afghanistan. Robbie, I don't think has specifically trauma related to babies, but he has lost, significant people. His former mentor, his stepson's girlfriend. So, there's definitely some stuff being tapped into there as well.
I know that life can be challenging, especially when it doesn't work out the way you expected.
Okay.
I thought I would be married with 2 kids in college by now. Maybe have some property with a pond. We could play hockey on it in the wintertime. And yet look at me now. No wife, no kids, no pond.
It's never too late.
Do you really believe that?
Yeah.
Only for me or for you too?
Okay. See what you did there.
Hey, I didn't think you were still here.
I was just talking to the neurologist on call.
And
We had a nice chat. She agrees I can work with double coverage.
That's not her call to make. You can't do anything critical where a 5-second lapse in consciousness could potentially kill a patient.
Ooh, this is going to be heated here. That's not his call to make, actually.
I agree. But 90% of our patients don't require critical procedures.
And the ones that do?
Will be handled by whomever's working with me.
Unless they're also tied up with a critical patient. What if it's a double or triple?
Robbie, I can handle it.
No, you can't, and I can't let you.
I am fully capable of
No,
handling...
you are not fully capable, and you know it.
What do you want from me?
I want what's best for this department, patients and staff. Best case scenario, you get a handle on this, you're seizure-free for 6 months, you get your driver's license back, you are cleared to work.
I am cleared for my driver's license.
You shouldn't be driving at all like this. If you were a patient, we would have to report you.
I am not your fucking patient.
No, but I cannot let you work in my emergency department until you're fully capable of doing so.
That is not your fucking call!
You're fucking ain't right, that's my call. I'm trying to protect you and my patients, and...
You didn't rat out Langdon for stealing fucking drugs.
No, but I kicked him out of this department until he got the appropriate help that he needs. And the same goes for you. You've got until Monday to let the administration know, or I will.
Oh, Robbie, dude. Like, on one hand, I can understand the intensity because look where they are, you know, and what he said has some merit in terms of, like, things don't always operate in a way that we can predict. There could be triple trauma, like no coverage, and then what? But, again, it's just not his call to make. He can't just unilaterally decide stuff like that and make threats of that, and damn, man, he's not handling this well.
Is this where you trying to talk me out of going?
Me? No, not a chance. Why, are you having second thoughts?
Nope.
No?
Nope.
You don't have to convince me. I mean, it is a little strange. The only place you talked about going is somewhere they used to drive buffalo off a cliff to die. I looked it up, and as far as summer vacations go, it's not exactly a holiday hotspot. I mean, what's in the fucking gift shop, man?
It's just one place I'm going.
As long as it's not the last. Don't be pulling a Thelma and Louise out there.
I am minutes from taking a 3-month vacation. When's the last time you took any time off, Jack?
Yeah, but I've dealt with my demons. It's a process. You wanna know why I never killed myself? After what I saw, lived through, losing my leg, losing my wife. Because it comes for all of us, man. You and I know it more than most. We see it every shift, but we can't let ourselves succumb to it. Yes, life can suck. It can be unbearable and brutal and ugly and heartbreaking, but it's also beautiful. And hilarious. And that woman today, her baby, they'd both be in the morgue if you hadn't been here. That's us, that's you and me. That's what we're here for.
The most important things I've ever done in my life have been in this hospital. Nothing will ever matter more than what I've done in this hospital, but it is killing me. You know how they say that a part of you dies when you lose someone you love? I'm not convinced that a part of you doesn't die every time you see a fellow human pass. And I've seen so many people die that I feel like it's leeching something from my soul.
I mean, that is 100% legitimate. And when you are, like, depressed, when you are feeling suicidal, your brain tricks you into thinking, like, there aren't multiple options. Like, you could retire. You know, you could suddenly, like, run away. You know, there's a lot of things that could happen other than ending it. So imagine that's probably what Abbott's going to say here. But, man, he's at crisis level.
Go on a cruise, man. Knock off this helmetless motorcycle shit. Yeah, people talk. That's death wish behavior.
I'm tired of being a role model. I'm tired of feeling like you can't get ahead. I'm tired of feeling like I'm drowning every day. I'm tired of all of it.
You need to get away for a while, and you need to get some help. You need this place as much as it needs you.
Am I fucked up?
Yeah.
100%.
Some great tough love. I mean, tender as well. Like, he showed emotion. They both had emotion, and he said what he needed to say, and, you know, said, this is in your hands, but, like, come on, man. Don't do it.
Okay, let's just...
25-year-old man. History, no meds, no...
Please tell me she doesn't have a seizure while driving. Oh my God. If she has a seizure while driving and ends up back in that hospital. Oh, fuck. Please tell me that doesn't happen. Second thoughts. Oh man. Can you fucking imagine, like, working your whole life for this and having stability that was hard earned for something that you never earned in the first place? You know, the disorder didn't come from anything that she did. And then this, ugh.
Why are you... Will you hit those lights on your way out?
Yep.
Why are you crying? Why are you crying, little one? You're okay. You're safe. Yeah, you're not alone.
Because they're not swaddled.
Yeah, you're okay. Do you need to be swaddled again? Is that it? Is that okay? I wish somebody would swaddle me. Yes, I do. Oh. You got off to kind of a rough start, didn't you, little one? Yeah, you did.
This is going to sound really cheesy, but it's both of their first time being human.
Well, that makes two of us. I got abandoned too. When I was 8. But I got through all of that, and so will you. I've got a good feeling that you're gonna be just fine. Everything's gonna be just fine. It's okay. It's gonna be okay. It's okay.
Is that where they end it? All right. Well, not the most satisfying ending. It does end on a hopeful note, you know, but now I just want to know what happens. You have to wait for another season. But that was the season 2 finale of Pitt. I hope that you enjoyed, and I hope that some of my musings were interesting to you. Let me know if I should react to the next season when it comes out, or if there are any particular episodes from the previous seasons you'd like me to check out and respond to that I've already seen. All right.